Hello all, this is Dr. Shilpi Reddy, Head of the Department, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. Today we are going to talk about miscarriages and how to avoid miscarriages. So, you have to know about healthy pregnancy before even knowing about miscarriages. It has been very long time since almost 20-25 years that I have finished my education and started talking to people about prenatal folic acid supplementation. But till date, we see women who are educated, who have a planned pregnancy, not taking folic acid before planning pregnancy. So it is important to reinforce that every woman who is planning pregnancy definitely has to have at least 2 to 3 months prior planning to be on folic acid supplements and vitamin D deficiency correction, and any specific correction that you already facing a problem, like some people are on anti-epileptic medication and you have to shift them onto the normal pregnancy safe anti-epileptics. Somebody on anti-diabetic medication should have good sugar control, HbA1c less than 6, that is ideal, and shift to a safer medication. Anti-hypertensives, the people who are taking random antihypertensives should be definitely shifted to safer antihypertensives in pregnancy. So all medical conditions should be under control, well in the norms of categories of drugs which should be safe for pregnancy use. Your vitamin supplementation should be on, and it is important to be in the best of state of health, because if you have any anemia, if you have any weakness, if you have any nutritional deficiencies, all these will impact pregnancy and their outcomes. So this is about women. And it is also important that men do take care of themselves, take their vitamins on time and check the sperm health and the quality of sperm in specific andrology labs, so that you will know if there is any issue, and any issues identified should be corrected before planning pregnancy. So it is both the quality of egg and quality of sperm that will give rise to a good healthy pregnancy and prevent miscarriages. And also it is important to do minimum tests of your thyroid, prolactin levels and your rubella IgG. If you just in case are negative for rubella, you can take a vaccine before planning pregnancy. These are certain hormonal tests like thyroid and prolactin, which will give a better insight for prevention of miscarriages, just in case if you have any problems with them. Risk factors for miscarriages are plenty. When you have to talk about risk factors, any risk factor that decreases the quality of egg, quality of sperm, implantation process, and which influences pregnancy growth will act on the etiology of miscarriages. Miscarriages can be because of the egg and the sperm. If you have to talk about sperm, definitely a poor DNA fragmentation index, that is DFI, can give rise to multiple miscarriages. Semen infection, the varicocele, is one of the etiology behind the high DFIs that men have. And there are certain chromosomal abnormalities, the Y chromosomal abnormalities, that can be one of the reason for recurrent miscarriages, and any familial disorders that can cause miscarriages. So this is one of the few reasons why men also can be a reason behind miscarriages of the women. And in women, there are multiple factors that play into the pregnancy. It can be the hormones like thyroid and prolactin that can have influence on pregnancy and miscarriages. Any changes in these hormones can cause miscarriages. Any progesterone deficiency can also cause miscarriages. Any deficiency of progesterone in PCOD can also cause miscarriages. Also, there is egg quality problems that can cause miscarriages. Along with all these things, the lining of the uterus should be apt for good implantation and the next level of growth of the baby. If there are any anatomical problems, that the uterus size, shape, structure, anything that is abnormal, then the miscarriages tendency is more. Not only this, there are ideal environments that influence the uterine environment, like thrombophilias, like antiphospholipid antibody, anticardiolipin antibody, lupus anticoagulant, SLE, and all these problems which are medically autoimmune problems and other specific problems that can cause recurrent implantation failures, recurrent pregnancy losses, and which have to be identified very clearly when you are taking history. One of the major causes for miscarriages these days is definitely PCOD. It is also a lot of influence on the egg quality that gives the kind of miscarriages that we are seeing. Not only PCOD, there are miscarriages seen when there is a space occupying lesion like fibroids or anything that is obstructing the cavity of the uterus. It can be a septum, or it can be a lot of endometriosis, a lot of restrictive environment. All these things play a role in good implantation and growth of the fetus. So anything that impairs the growth of the fetus definitely can lead to miscarriage, and it can be a single problem or it can be a recurrent problem, when especially it is related to genetics and gene related, and also the autoimmune problems that if they have. So it is important to diagnose the reason for miscarriage, but on a layman's term, 1 or 2 times a miscarriage without any reason can also happen. Because if you have to talk about the rates of implantation and the rate of take home baby rate, most of the time when we have implantation also, 40 to 50% of pregnancies do not cross the next period date, because they themselves get resolved. And even after you are pregnant, the chances of miscarriage is also there. Without any reason, a spontaneous miscarriage is also there in 10 to 20% of the people. So technically 60% of pregnancies do not go up to the delivery time. Most of them are dropped because of quality issues and the natural selection that happens in your body. Miscarriage has clinically very clear picture. Whenever you don't get your period on time, you do a pregnancy test. So when you do a pregnancy test, it is positive and you've gone for you would definitely go for a medical examination and confirm your pregnancy. And after confirmation of pregnancy, if you start bleeding, that is one of the signs for a threatened miscarriage. You should definitely go to a gynecologist, check for the reason for any kind of bleeding or spotting or any kind of unknown pain that is there. And when you do an ultrasound and you do not find the heartbeat or the fetal pole or the yolk sac, whatever said and done, which matches according to the period of gestation and your pregnancy test confirmation date. So it is important to know what is what. If you have missed your period today and you do a pregnancy test and it is positive, you are likely to see a small gestational sac after a week or so inside the uterus, and a yolk sac and fetal pole after 2 weeks of pregnancy test diagnosis. So it is important that we have to locate heartbeat, say somewhere between 6 and 7 weeks of pregnancy, that is 6 or 7 weeks from the last period date if you have regular cycles. If you have irregular cycles, then when you do a pregnancy test, if your beta HCG shows up to a level of 2 or 300, then you can count it as the end of 4th week of pregnancy, and from there in about 2 weeks to say about 16 or 18 days, you should see a fetal pole, a yolk sac, proper yolk sac, a fetal pole and a cardiac activity. So that is also important. Or somebody who has done an ultrasound randomly and they have irregular cycles, they have seen a pregnancy sac inside, and when you follow up that ultrasound for the next 10 days, then if you locate the yolk sac, fetal pole and the heartbeat, it means it's an ongoing pregnancy. Anything that is a yolk sac, a large yolk sac, a large sac, without any fetal pole or a fetal pole without any cardiac activity definitely indicates miscarriage. So, miscarriages can be diagnosed clinically by bleeding, pain, heavy bleeding, passage of clots and pain associated with it, and also by ultrasound. When you go for serial ultrasounds and you don't find the required amount of size and growth of the baby and the heartbeat, definitely you can diagnose miscarriages even on ultrasound. There are several treatment options for miscarriages, but yes, for a single miscarriage, for the first time if you had any miscarriage, definitely you can, the options are very evident. You can go for medical management through medical methods, which is about 95 to 97% successful, and there are surgical methods of cleaning the pregnancy by a dilatation and suction evacuation and a check curettage. So nowadays, to prevent any infections and PIDs and all that, so we are advocating medical methods of termination by medicines itself, wherein we give medications in a dose manner so that everything expels by itself by the influence of medication. But it should be very important that at this point of time we have to emphasize the role of improving the egg quality and sperm quality, and definitely improving by giving them vitamins, folic acid and antioxidants. Not only these, you have to get evaluated minimum for the thyroid, prolactin levels and any kind of deficiencies that they are having, or a detailed evaluation of any familial history or genetic problems or autoimmune disorders in them, and also evaluate the male partner for any infections, any sperm disorders or sperm motility disorders or normal the structure of the sperm disorders. So all these things have to be emphasized for a healthy planning the next pregnancy. So definitely people ask us what is the gap that they have to take to plan next pregnancy. If there is an etiology that is identified, you have to correct that etiology and go forward. Whenever the correction is done, you can go forward. For example, if it is a thyroid, hypothyroid, and the TSH levels are 12 or 15 or 20, so definitely once the TSH levels come below 2.5, you can plan pregnancy. Or if it is a sperm DFI, increased sperm DFI and specimen infections or a varicocele, definitely after the correction of these problems, you have to go for next planning of pregnancy. And if you have any autoimmune disorders like systemic lupus erythematosus, or you have antiphospholipid antibody or a lupus coagulant antibody, or any kind of problems that are specifically identified, yes, you have to rectify them and go according to the protocols and norms. If you have a genetic problem or a genetic problem that is identified, definitely if you have a history of genetic problems, if you have a history of recurrent pregnancy losses, if you have history of any tuberculosis, or if you have history of any lining disorders or anatomical disorders or any fibroids or any septums, definitely you have to look into the correction of such things and then plan pregnancy. So it is important that we diagnose the problem and treat it sufficiently so that the next pregnancy will at least be a good one. And there are many people who spontaneously conceive and have normal deliveries even after 2 miscarriages. So it is important that diagnosis and treatment is definitely has to be in the first line. If any genetic problems are identified, especially when it is a recurrent pregnancy loss and you identify genetical problems in the chromosomal abnormality in the fetus, and if you see a chromosomal abnormality in the any of the partners, definitely you have to go for correction and look into options like PGS and PGT, where you can identify and put only the selected the normal embryos into the uterus, so that by IVF, so that you don't land into recurrent pregnancy losses. So it is important that every aspect has to be looked into and taken care to prevent any further losses. When you have to talk about precautions for prevention of miscarriages, it is important to know the reason for miscarriage, especially when it is recurrent pregnancy losses. Definitely you have to know the reason for miscarriage and then go systematically evaluating those problems and prevention. So prevention is definitely going to be a better role playing than treating any problem at a later date. So treatment options are for women and men equally. So whenever the identified problem is treated well, definitely you will have good good option of having a live birth. And when we have to talk about prevention aspect, unplanned pregnancies are one of the most common reasons of having a bad outcome in pregnancy. So definitely you should have a planned pregnancy, a good folic acid and multivitamin supplementation, an ideal condition, especially people who are diabetic and who are high BMIs. They have to rectify their weight and reduce their weight before planning pregnancy, and reduce the HbA1c to less than 6 before planning pregnancy. And any unsafe medications have to be rectified before planning pregnancy, and anemia is one of the correctable factor. Definitely any hormone imbalances also have to be corrected before planning pregnancy. Health is a state of well-being, not only physically, mentally, but emotionally, and psychological well-being is also important. It is very important to emphasize the role of mental health and mental well-being when you're dealing with such kind of a scenario of pregnancy losses. They definitely have to have good, tender, loving care and support of the family, especially when women are dealing with miscarriages. It is pertinent and very important for that delicate balance of family life that is important. And preventing problems is also not only prevention of physical disabilities, physical problems, hormonal problems. It is also prevention of psychological problems and ill health pertaining to women, and also help when it comes to any problems with the men. So it is important that they go for a very good family counseling session wherein they can have any problems resolved. So prevention is always better than cure, and preventing problems that are the causes for miscarriages have to be definitely addressed before planning any pregnancy.